is New York getting ready for distribution? Well, the state already has a plan in place and really wasted no time. Governor Andrew Cuomo saying 170,000 doses of the vaccine are on the way.
It could arrive as soon as this weekend. That assumes the FDA does act right away, the FDA does approve it, and the military turns around and ships it immediately, but it could actually be coming this weekend.
So here to break down Governor Cuomo's step-by-step plan on vaccine distribution across the state is Lieutenant Governor Kathy Hochul. Good morning to you, Lieutenant Governor. How are you doing this morning?
Morning, I'm doing great, thank you.
Thanks for being here. So let's get to this. We just heard the governor right there say the doses could come as early as this weekend. The state getting these 170,000 doses. Can you break down what parts of the state will get those doses? And when you say 170,000, does that mean 170,000 will get it, or is that for both? Like, is it half of that because the shot is two shots?
No, that's for the first distribution of them and for the first vaccination. So there'll be another supply come. We don't need that for another 21 days after the initial people get it. So that's great news. But let's think about the fact that this is a sign that we're finally seeing the end of this long, drawn-out drama that has just shaken everyone to their core. Every business, every individual has suffered so greatly, particularly in New York City. So having the vaccines literally in transit this weekend coming to New York State, we've been ready for this since last July when the governor put together a blue ribbon commission of individuals to help review the effectiveness of the vaccine and simultaneous review with the FDA, which is going on right now, but also how are we getting it out there? So let's talk about this. There are literally refrigerated trucks that are going to be ready to take them to 90 areas, 90 distribution areas that have already been identified in New York State. New York City itself, based on the number of healthcare workers and essential workers and nursing home patients, will get the first doses, 72,000, which is fabulous. So Long Island will get nearly 26,000. So we've got a plan, Mid-Hudson. They're going all over the state. I'm telling you, this is going to be the biggest operation since World War II in this country. But New York State, if we do anything right, we know how to prepare for mass operations, whether it's battling a pandemic or battling a hurricane.
Right.
So this is something we're very comfortable with doing.
Lieutenant Governor, this is a big deal. A lot of people anticipating this, wanting to get in line for it. How are people being determined, okay, you get it, but you have to wait?
And I think people understand this, that there's not going to be mass inoculation, which is going to be necessary for us to declare an end to this, probably till late spring, summertime. And it all comes down to the supplies coming from the pharmaceutical companies. We can get them out. If you get us everything we need today, we know how to get this out. We have partners in the hospitals. We're going to make sure we're focusing on communities of color, particularly in New York City, which was hit so hard when we realized there are healthcare deserts. We lost many lives because people didn't have access to health care.
So, but who determines who gets it? Is it the hospital that gives you the list? Is it a doctor's office? Is it the state? How people get on that list to get the vaccine?
Great question. And again, the CDC also has parties that are in sync with ours. Nursing homes first, nursing home staff simultaneous. That'll be taken care of immediately. After that, it gets out to the frontline essential healthcare workers. There are 700,000 healthcare workers in the state, but a smaller percentage, maybe 20%, are the ones that are interfacing with patients directly. The ER staff, the people who are working in the pulmonary units, the ones who are dealing in the ICUs, they will be first, but the individual people will be determined by the hospital. So we have our categories of priorities, even within the healthcare realm. Hospitals, and it makes sense. We want the people who are dealing with the COVID patients to be protected first, and that is our highest priority. After that, when we get our next doses, which we don't know have a time frame yet, we'll be able to get beyond the healthcare world to get into the essential workers who are out there exposed every single day. So it's a massive undertaking, but I assure everyone a lot of thought has gone into this, and eventually it'll get out to the general public, and then you can go to a doctor's office, a pharmacy. Depending on your community, you may be able to go to a church, a community center, or a synagogue. We're going to get it out there in ways that are very accessible to people.
And so let me ask you this. If the FDA approves it today, right, if they give the emergency use authorization, at what point are those trucks pulling out and going to those first areas of need?
We are already in conversation with the FDA, so we're not losing a minute's time. And that's what we promised. We're not going to have this delayed. But we also want to make sure we have a seal of approval from New York State. There is a lot of skepticism out there, understandably so, with the way Donald Trump's political cronies have politicized even the operations of managing a pandemic. We saw what happened when his political hacks were infiltrating HHS and other places where they're having undue influence. So because of that skepticism, which is very well placed, we want to make sure that people feel confident in this. And
Are you
also
referring to the
another issue
skepticism about the vaccine? There's this study that came out that said 75 to 85% of New Yorkers need to get it in order for it to be effective and drive down numbers, but there are the skeptics who say, I don't want it, I don't trust it. Is that what you're referring to?
Absolutely, and that was, we want to let them know that we trust it now. You know, once we say okay, and that'll be within hours, we will be able to say that we also think if it gets the New York State seal of approval, Governor Cuomo, who has led this state and this nation through this pandemic, if he says it's okay and he's going to get it, I think that sends a clear signal to the general population that they should trust this, because we're not going to let anything get out there that we personally would not use ourselves or even inject our children with. We have to have that level of confidence. When we get that confidence, we want to make sure the public feel the same way. We're also concerned about the fact that the CDC tried very hard to eliminate undocumented residents of our communities from getting the vaccine. They were going to require onerous information, have to provide proof of citizenship to get a vaccine. Are you kidding me? We had a fight with the governor leading the charge, with our immigration advocates, to say that's not going to work. You need to have everybody vaccinated or it's not going to be operational and be truly effective to get our economy going again.
Well, but on that same token, though, Lieutenant Governor, to get everyone vaccinated, that's a lot of vaccines. Right now, we're only getting 170,000. And in the grand scheme of things, there are millions who live here in the state. So how do you work that into the system? It seems like it's going to take a long time for everyone to get vaccinated.
Right, and we're being very honest right from the get-go. I mean, we're telling people the reality check is, yes, we have this first dose. We cannot control, we would like more, but this is all we have right now. That's why we have this very specific system of priorities, who needs to get it first to protect people who are most exposed. Then we can get into another allocation of individuals who are our frontline workers in different jobs where they're exposed to the public. When we get it out to the general public, though, this is going to be months from now. And that is why people should not think that they can be complacent, or I don't need to wear a mask, I'll just get the vaccine, I'm going to be fine. That's not happening maybe till spring, even summertime. That's what we have to get people's expectations kind of adjusted here, so they don't think they can run out tomorrow and get a vaccine.
Right.
Understood. And we only have about 20 seconds left. I want to squeeze this question in for you. Starting next week, restaurants and bars, because that is big, could face new restrictions. Any idea when Governor Cuomo is planning to release those new restrictions and what exactly they would look like?
This all comes down to two net metrics. Infection rate, which is over 5% in the city of New York, which is not acceptable, and our hospital capacity. And right now we're watching the number of beds available with staff and ICUs. So I don't have an answer on that, but we're all watching this closely because our number one priority is to protect public health. We are seeing a second, third wave, and it's hitting New York City and New York State hard right now. We're still the fourth lowest in the nation, but the rest of the country is imploding right now with skyrocketing cases, and we do not want to be those states where they cannot handle the number of patients presenting themselves. We've been there, we've seen that movie, and we're not going back ever again. We're ready for this next wave. We're going to be smart about it.
Understood. Lieutenant Governor Kathy Hochul, appreciate you joining us this morning on all of these topics.
Yes,
very important stuff here. If we don't talk to you, have a safe and happy holiday.
Thank you. Same to you.